Hey guys, welcome back to the series of case-based scenarios. In this video, we are going to see about a very easy and very interesting and a very important thing, that is tooth numbering systems from the subject dental anatomy. So this is Dr. Janvi. So let's just begin with this. So tooth numbering systems. So how many systems do we have? So we have, it is 3, right? So used to associate information to a specific tooth. The 3 main systems we have is Universal System, Zsigmondy Palmar System, and Federation Dentire International. Let's go through the Universal System now. So as you can see in this image, so this is permanent teeth and this is primary teeth. Okay, so this is permanent teeth. So the primary teeth are named from A, starting from A in maxillary second molar, representing the maxillary second molar on the right side, to T, representing the mandibular second molar on the right side. So this is the how we represent it. Okay, and coming to the permanent teeth, we start with number 1, representing the maxillary right third molar, to number 32, representing the mandibular right third molar. Okay, so this is how we represent it, but this thing is not required when we are using, this notation is not required when we are using a universal system. Okay, simply we can just say 1 to 31, or when coming to primary we can just say CO, like that only. Okay, coming to Zsigmondy Palmar notation system. So this is where we require this symbol. Okay, so as you can see this in this symbol, so this one represents upper right quadrant and this one represents upper left quadrant. Okay, and this one represents lower right quadrant and this one represents lower left quadrant. So this is common for both primary and as well as permanent dentations. So as you can see from this chart, it can be named like this. So this can be when we are denoting multiple number of teeth, we denote it like this. Okay, so this is for permanent and this is for primary, and when we are denoting a single tooth, we denote it like this. Okay, coming to the FDI system. So this is the most common system that we use in our clinical experiences. So as you can see in the primary thing, what it is, the quadrants are divided into like this. So it starts with 5 and ends with 8. Okay, so the 5 represents the maxillary upper quadrant, right upper quadrant, and 6 represents the maxillary left upper quadrant, 7 represents mandibular left lower quadrant, and 8 represents mandibular right lower quadrant. So this is how we denote the quadrants of primary tooth in FDI system. And coming to teeth, starting from 1 to 5. So 1 represents central incisor, 5 represents what? Second molar. Okay, so depending on the quadrant, the number changes. It will be 5-1 representing maxillary right, 6-1 representing maxillary left, 7-1 representing mandibular left, and 8-1 representing mandibular right. So this is how we do it for primary. The same goes with permanent. In permanent, the quadrant is divided into 1, 2, 3 and 4. Okay, the quadrant is divided like this. Okay, so when we are doing that like this, so in this the tooth are numbered from 1 to 8. Okay, so 1 is the incisor, central incisor, and 8 is the permanent third molar. Okay, so this is how we represent it in the FDI system. So it is a 2-digit system which is proposed by FDI and adopted by WHO. So see a clinical scenario. So a 3-year-old boy reported to a dental clinic with pain in the lower left side of the jaw. So on intraoral examination, the posterior tooth showed deep carious lesion. Identify the affected tooth number. So as you can see, it is a 3-year-old boy. That means we need to go with primary definite tooth numbering systems. So from the options given, you can see that it is of FDI system, right? How did I say that? Based on these numbers 7, 5, 8, 5, 3, 5 and 4, 5, right? So since it's a kid, we can't go with 3 and 4 because they belong to adult quadrants. So these both are ruled out. So the left out is 7, 5 and 8, 5. So they are saying that it is lower left side of the jaw. So from this notation, what we know, it starts with 5, 6, 7 and 8. So lower left side. So this is right side. Okay, and this is left side of the jaw. Fine. Okay, so lower left side is 7. So it is a lower left side tooth, that is 7th quadrant, and the answer will be A75. Okay. So if you like our video, do share, like and subscribe to our YouTube channel, and you can also follow us on our Instagram handles at DOCSHAALA for dental content and at DOCSHAALA medical for medical content, and you can also follow us on Telegram. Thank you.